But right now, we want to turn our attention here at 9:55. Since taking office, the Trump administration says it's made some major strides, changes at the Department of Veterans Affairs, especially from reducing benefit backlogs, as well as expanding some health care access. Joining us this morning to discuss their efforts and what it means for veterans here in the Carolinas and across the country is Secretary of Veterans Affairs, Doug Collins. Secretary Collins, thank you for joining us here this morning.
Jane, glad to be with you.
So tell me then about the VA today versus a year ago. What is the biggest difference that you want us to notice?
The biggest difference is the VA now is focused on a veteran, and not our organization, not how many employees we have, not our budget size, not how many facilities we have. It's focused on, are we doing what we're supposed to be doing? And that is take care of veterans. So it's a veteran focus. So that means that when you look at getting them into our healthcare system, how do we get wait times and our appointment times quicker and better? How can they make it easier? We're doing that. Taking backlogs of over 125 days of claims, over 260,000 of those, lowering those to 75,000 or less in 77 days to complete, as opposed to 135 days it was taking just a year and a half ago. Opening up to over 2 million plus hours for new appointment times in the evenings and on the weekends, so that our younger veterans in particular can take advantage of the VA services after they get off of work. Those are just a little bit of what we're doing, opening new facilities, 35 plus new facilities across the country. The VA has a new attitude, and it's about a veteran.
The backlog for veterans, you said, has been reduced significantly. How is that achieved? And then if anyone is still waiting on a disability claim, what do they do right now?
I just continue to work the process. We're dropping those as quickly as possible. Some of those, again, sometimes claims have to deal with not just the VA perspective, but maybe paperwork related for. We're working on how we get those quicker and how we can make that an easier position for the veteran to get that documentation to us. But I think the big thing is it was just a focus. It became common practice for this backlog to just exist. We were not doing anything to actually start taking it down. So last year I said, we're going to make this a positive statement. We're going to actually put people on it. We're going to put overtime to it. We're going to do whatever we have to do to bring this down so our veteran experience is much better. And I think that just focus, I hear about it every week. It's in part of my briefings that I get every week on where our backlog status is. So again, it's the old saying, what gets measured gets done. Well, what gets measured for me is, are we taking care of veterans?
And then as far as some of the other frustrations on just simply getting appointments, what progress has been made on some of the wait times?
A great deal of appointments on those. And again, remember, the VA is the only system that measures wait times. All your other hospitals in Charlotte and across North Carolina and Western North Carolina, they don't measure wait times. We do, because of some scandals that happened about 15 years ago. And so what we're doing is making it easier. Our system of scheduling has been outdated for 30 years. We're putting in a new electronic health records management system, also working with a new scheduling program that actually helps and lets the veteran have more control over their own scheduling by having it something they can do electronically. This is something the community's been doing for years. We're just catching up to that, and we're going to continue to make it easier.
North Carolina, home to one of the nation's largest military veteran populations. Any specific message you have for our veterans and military families here?
Well, I think the ones, especially those who are currently serving active duty and reserves and others, when they get out, is I would encourage them to go to va.gov and begin the process of getting integrated into the VA system, whether they use it fully or not. Get that initial process done quickly as you get out, because that'll help. You're fresher on your mind, you're ready to get it done, and then you have that ability to keep that benefit throughout that you've earned throughout the rest of your life. And it helps with us with preventative care and helps you as things develop as you get older. So I think the biggest thing is the VA is now focused on you, the veteran, and we've had a lot of great input from veterans on how we can make it better, and we're including those in everything we do.
Secretary of Veterans Affairs Doug Collins, appreciate that we were able to check in with you and the status of the VA. Appreciate the time.
Thanks a bunch.